Originally from Corpus Christi, I was looking for a university specific to advanced practice to train as a neonatal nurse practitioner. And I had a couple of choices in the state of Texas, and so I came up to San Antonio to interview. They were quite interested to understand what I wanted to get out of that experience. I felt that connection with the faculty then, and I still feel it to this day. Magnet is sort of the gold standard for nursing excellence. You build that foundation by providing resources for nurses either at the leadership level or all the way to the bedside. And so we look to UT faculty from the School of Nursing to help us build that foundation. You lead a lot of teams through improvement, and that impacts patients, it impacts the nurse practice environment. And so what the faculty impressed upon me was that number one, we are here to be good stewards of our profession and to promote scholarship. And how do you take the best evidence? How do you take research and translate that to the bedside to improve patient care? Nurses at the bedside are the ones that spend the most time with patients. And so what they have to say is extremely important.
My grandmother used to be a nurse as well, and she was always very caring and loving and compassionate towards others, and I always knew that that's the type of person I wanted to grow up to be.
Nursing is in that unique position. We're perfectly positioned to be in that moment with that patient. Human touch is extremely important, and because we spend so much time at the bedside, it's an essential component of what we do.
That human connection, that human touch, the feeling of being rocked and swaddled and talked to makes all the difference in the world.
It's not just about giving medications. It's not just about physiologic parameters. It is about building that trust with that patient and helping them recover or rehabilitate.
The smallest outcomes that are achieved become the biggest victories for us. And no matter how small our patients are, they always leave a big footprint in our heart.
Over the years, it's been really important for me to evaluate what my values are and am I still in the right place? And invariably, my answer will always be yes at the end of the day. And that's because we have the best of both worlds here. We've got UT Health, we've got UHS. We're serving the community, and that's really important to me, and you see that often in UT faculty. At the end of my career, I know I'll look back on this and I was at the right place. I'm just really blessed. I've lived a charmed life, I like to say.
As a young nurse, I was very aware of the impact of an illness on the family, but I was even more aware of what the family brought to that individual living with a progressive disease, a chronic illness, and how important the support of the family was for that individual.
It was a blind date, and initially we didn't really click, and then about a year later we clicked. And he was a good dancer, still is. He was tall, he was good looking, all the prerequisites. They're wonderful memories that we have. We boated, we traveled extensively. We built homes and have grandchildren and great-grandchildren. And occasionally we'll get frisky and sort of dance around the carpet here or the floor.
So the Caring for the Caregiver program really helps families to live well with dementia. We're all waiting for a cure, and that's really where our mindset is. But in the meantime, there's more than 5.8 million people in the U.S. living with Alzheimer's. There's more than 16 million caregivers caring for those families. So we need to support them in our communities.
Michael and I together would go to the Caring for the Caregiver classes, and I was like a dry sponge. I just couldn't get enough of it. If you get one little nugget of information out of a session that you can take home with you, it's a win-win. And you put a lot of nuggets together, and pretty soon you have something that is life-changing.
Dementia is like living with a big hole in your head. A lot of things that I used to know, and others are saying, it's not there anymore. It's just blank, it's black.
If Michael were to live through all of the stages of dementia, we know where it will end up. But we also have enough confidence in our medical team that when it comes time that Michael might need a different type of environment, they will say it, and I will not argue with them.
With the aging of our population, we know that about 1 in 10 people over 65 will have some form of dementia, and 1 in 3 over 85. And so there's not many families that are not going to be confronted with this crisis.
Each day is interesting and new. I know that the point will come someday where I can't think of tomorrow. We'll see what happens.
As a nurse, it's a privilege to care for families living with dementia, the individual and the family caregiver. Not only am I able to care for them through the art of nursing, but I'm able to bring the research and the science of nursing to make a difference and to make their lives better. I feel privileged.
We're going to live life to the fullest, probably more so than we did in the past. We've got a few trips planned, domestically as well as internationally. And yeah, we're going to live it. That's the important thing.
Love you.
I was born at a time in April when the short rains were supposed to come, but they didn't come. And so there was no food, and there was a famine, and everything died. And my father told me that almost 16 babies were born that year at that time in our village, and they all passed away, except one, and that was me. Chief Zinalo's child also died. And he had the generosity of heart to give his only cow to my father to save me. The thing is, my parents were both refugees. They had fled Uganda because of Idi Amin. For them to receive so much generosity in a place where people had nothing, like other people were dying too, their children were dying, it really molded them into probably some of the most generous and kind people that I ever knew. And I think in turn, they tried to mold me in the same vein. I became a nurse because it aligned with my life goals of being a good person, of helping people when they really need it. Right now, I work as a home health nurse. I get to spend time with my favorite person in the whole world, my little patient, baby Jacob. Baby Jacob has cerebral palsy. He's a spastic quadriplegic. He's also blind, and he's deaf. Jacob is, in many ways, my best friend and the best person I know. It's Jacob that makes me believe that there is something bigger than me in this world. When I look at Jacob, I see an angel inside him. I see something pure and something good and something perfect even inside him. When he smiles at me, I feel my whole world light up. I feel a type of happiness and satisfaction from knowing that I made today better. I can't solve all of Jacob's problems. I can't make him see, I can't make him hear. But I can make today better. I can hold him and I can hug him and I can tell him I love him. I can speak life into him. And that's all I set out to do as a nurse. When I wake up in the morning, I know that I can't solve everybody's problems. I can't make my patients magically healthy. I can't make my patients magically take all their medicines. I can't make my patients wealthy enough to afford their medicines. But I can make them get through today with me at their side. Of all the places I could be in the world, of all the things I could be doing, I choose to be there every single time. I'm a nurse. This is nursing.